Welcome to our academic boardroom, where we have been discussing water coil. And then we have discussed the amine water coils. We discussed histamine, serotonin. We also have discussed lipid-derived water coil, where we discuss prostaglandin, thrombosin, leukotriene. Today we will discuss the second division or the third division of water coil, that is peptide-derived water coil. And we are going to pay a little attention to angiotensin because of its involvement in blood pressure, fluid balance, and electrolyte homeostasis. Angiotensin is a peptide hormone that plays a critical role in the regulation of blood pressure and fluid balance and electrolyte homeostasis. Electrolyte is sodium ion, chloride ion, bicarbonate, and then potassium ion. Angiotensin is the key component of renal angiotensin-aldosterone system, which help control blood pressure and fluid balance in the body. The renal angiotensin-aldosterone systems will be our major focus in discussing angiotensin. So the renal angiotensin-aldosterone systems, the purpose for this system, that is renal angiotensin-aldosterone system, is to regulate blood pressure, blood volume, and electrolyte balance. And the component of this renal angiotensin-aldosterone system is as follows. The renal, which is an enzyme that is produced by the kidney or from the kidney. The second component of this system is angiotensinogen, which is a plasma protein synthesized in the liver. And then the third component is angiotensin, which is a peptide hormone that is derived from angiotensinogen. And then the last component is aldosterone, which is hormone that is released from adrenal cortex that promotes sodium and water reabsorption. This is the four components of renal angiotensin-aldosterone system. The biosynthesis and the conversion of angiotensin. The biosynthesis of angiotensin involves 4 steps. Step 1, step 2, step 3, and step 4. The step 1 in the biosynthesis of angiotensin is involve the production of angiotensinogen from the liver. And then step 2 involve the secretion of the renin by the kidney. And this will happen in response to low blood pressure, and also in response to reduced sodium concentration, and also in response to sympathetic nervous system stimulation. These are what actually leads to the kidney to secrete renin, that is part of the angiotensin, renin-angiotensin-aldosterone system. And then the third step is that the renin converts the angiotensinogen into angiotensin 1. Of course, they have the capped peptide. So the renin acted on the angiotensinogen that is produced by the liver, and it will convert it to angiotensin 1. The first step is the conversion of angiotensin 1 to angiotensin 2. And this happens in the presence of angiotensin converting enzyme ACE, which is primarily found in the lung. And this enzyme converts angiotensin 1 into angiotensin 2, which is an octapeptide. It is significant to know that angiotensin 1 is biologically inactive, but angiotensin 2 is biologically active and is the most potent vasoconstrictor in the body. We see his involvement in hypertension or blood pressure. We can appreciate this student to understand the mechanism for the biosynthesis of angiotensin. We have earlier said that angiotensinogen is produced in the liver. And when there is a decrease in blood pressure, decrease in sodium and chloride, and also the sympathetic nervous system is activated or enhanced, the kidney will produce this enzyme called renin. This enzyme will act on angiotensinogen to convert it to angiotensin 1. And this is where it is. And this angiotensin 1, as we have earlier discussed, will be acted upon by angiotensin converting enzyme kinases 2, which is, and then it will convert the angiotensin 1 to angiotensin 2. And of course, the reaction goes further with the involvement of aminopeptide, and angiotensin 2 will be converted to angiotensin 3, and then down to angiotensin 4, which is actually the inactive fragment. Angiotensin 4 would also be acted upon by angiotensinase to produce inactive fragment up to, of course, through the angiotensin 3 too, can be acted upon by angiotensinase to the inactive metabolite. This is a very simplified pathway for biosynthesis of angiotensin. Of course, it's good for us to mention here before we leave, as we have earlier said, that the angiotensin 1 is biologically inactive, but angiotensin 2 is potent and active, and is one of the most potent vasoconstrictor in the body. So what actually happens, it causes vasoconstriction, which leads to rise in blood pressure, rise in BP. Also, this angiotensin 2 can activates the adrenal cortex to release aldosterone. And the aldosterone secretion will lead to sodium and potassium, sodium and water retention that increase the blood volume. And the increase in blood volume will increase the cardiac output and which will contribute to increase in BP or blood pressure. And then the constriction of the blood vessel will also lead to rise in blood pressure because the peripheral resistance will increase, and then automatically this angiotensin 2 is highly involved in increase in BP or blood pressure. I think this makes sense. Let's quickly go through the function of angiotensin 2. Number one, angiotensin 2 has multiple physiological effects that contributes its role in maintaining blood pressure and fluid balance. The first function is its ability to cause vasoconstriction. So it has a vasoconstriction that leads to narrowing of the blood vessel, which invariably automatically increase the blood pressure. The stimulation of another function of angiotensin is the stimulation of aldosterone secretion from the adrenal cortex. This aldosterone secretion increases sodium and water reabsorption in the kidney that leads to increase in blood volume and pressure. The third function is that angiotensin 2 promotes antidiuretic hormone release, and which actually enhance water reabsorption. ADH, antidiuretic hormone, which increase renal reabsorption. And then the fourth function is increase in sympathetic nervous system activity by enhancing the release of non-epinephrine, which further increases the blood pressure. Okay, and also it also stimulates the test mechanism, which increase fluid intake to raise the blood volume. So these are the 5 major functions of angiotensin 2. Okay, so the angiotensin 2 needs receptors to actually function, and 2 major receptors has been identified. And for it to be able to exert its pharmacological or physiological function, it has to bind to specific receptors. And 2 receptors, AT1, meaning angiotensin receptor 1, has been identified. These AT1 receptors is responsible for most of the classical effects that we've seen in angiotensin 2. Effect like vasoconstriction, effect like aldosterone release, and effect like increase in sympathetic activity. The second receptors is AT2 receptor, that is angiotensin 2 receptors. This involves, interestingly, it involves in vasodilation, also antiproliferative and anti-inflammatory effect. So these receptors are less well understood, but I believe to counteract some of the effects mediated by AT1 receptor, that is angiotensin receptor. That is the interesting thing that you must pay attention to here. Okay, so it's good for us to also look at the few pathophysiological role of angiotensin. Of course, the excessive or prolonged activation of renal, angiotensin, and aldosterone system can contribute in not a small way to several clinical conditions. Conditions like hypertension due to the chronic vasoconstriction and fluid retention as a result of angiotensin 2. Also, it also contributes to heart failure by promoting cardiac remodeling and fibrosis. Also, the second clinical effect is chronic kidney disease through the increase in glomerular pressure, and also which leads to damage to the renal tissue. And also the fourth one is atherosclerosis, that by promoting inflammation and endothelial dysfunction. These are the pathological role of angiotensin gene, angiotensin 2. The clinical implication and some few drug targets of this renal angiotensin aldosterone system, which have been used in the treatment of hypertension. We have seen from a few discussions how this renal angiotensin and aldosterone system can lead to hypertension, heart failure, and other cardiovascular disease. And we quickly look at a few therapeutic intervention. The first one is the ACE inhibitor, that is angiotensin converting enzyme inhibitor that converts angiotensin 1 to angiotensin 2. And a good example is enalapril and lisinopril. They inhibit this enzyme that can convert angiotensin 1 to angiotensin 2, which is the most potent all of them. So they actually block the conversion of angiotensin 1 to angiotensin 2, leading to decrease in vasoconstriction and also aldosterone secretion. Number 2 intervention is the blockage of the angiotensin 2 receptors, AT1. Once the receptor is blocked, then the angiotensin 2 will not be able to exercise its vasoconstriction and also the aldosterone secretion. And the good drug that have been very effective for this is losartan and also acetan. They block the binding of angiotensin 2 to AT1, that is angiotensin receptors, to prevent the effect of angiotensin 2. I think it makes sense. We can also use a drug that can directly inhibit renin, so that angiotensinogen will not be converted to angiotensin 1, and of course, the production of angiotensin 1 will be inhibited. Once the activity of renin is inhibited, then there are going to be reduction in the production of angiotensin 1, and when that happens, angiotensin 2 will not be produced. And if angiotensin 2 is inhibited, then the vasoconstriction release of aldosterone will also going to be inhibited. And a drug like alectrine has also been identified. And also the fourth intervention is using antagonists, mineralocorticoid receptors antagonists like spironolactone, and then they block the effect of aldosterone and promoting sodium excretion and reduce blood volume. These are the what I think at this level we want you to know about angiotensinogen. You need to internalize this as we continue this study. I believe that this video has enhanced your knowledge to a greater extent. See you in our next class.